My name is Paul Berry. I'm a assistant professor of plastic surgery at the University of Texas Rio Grande Valley. I've been on staff now for a little over a year and a half. I'm one of two plastic surgeons in our group, and we both are committed to looking after the folks here in the Rio Grande Valley and children and adults. Cleft and craniofacial defects it's actually a pretty broad topic. First, we have congenital defects, as the name implies, patients are born with. And then we have deformities that are acquired or the result of certain things like trauma, burns, and removing of tumors. In terms of the congenital deformities, we have some common ones like cleft lips and cleft palate, which are fairly common. The way they affect people, feeding, things like speech development, brain development, but then just simple things like an aesthetic deformity that can result in difficulty with their psychosocial development. Well, certainly the acquired ones we know, right? Because usually you can tell, or the parent or a child comes in with a history of. But the most of the congenital ones, to be honest with you, we don't know. We have lots of information about things that correlate with these. For example, let's talk about cleft lip and palate, again, one of the more common ones that we see, and certainly the ones in my practice that I see most often. We have associations with certain nutritional deficiencies in moms. For example, one of the reasons that we really encourage women in the prenatal period to be good about taking in folate, well, some of these deformities are associated with folate deficiency. In other situations, we know that there's some sort of genetic predisposition because once there is a child in a family with cleft lip and cleft palate, the result, or a parent of that child had a cleft lip or palate, the risk for a subsequent child having a cleft lip or palate goes up substantially. We tend to treat most of these conditions in the first 6 to 24 months of life. Usually it's a thankless job from the point of view of the patient, right? I mean, they're cute, they're adorable, but they're not big on thank yous yet. So most of the initial benefit goes towards the parents and the caretakers that really love these children. For example, like one of my very favorite conditions to treat is just cleft lip. Part of the reason is that these children are otherwise completely normal, healthy children for the most part, but they have a very distinct feature that people almost can't turn away from. And so it can be very difficult for a parent who loves their child. And after literally an operation that takes maybe the better part of 2 hours, we hand them back, and they're still perfectly healthy, but this great deformity that was visible for their first all their life really is gone, and it's a really powerful thing. So to find out more information, you can go to uthealthrgv.org or the plasticsurgery.org or the National Cleft and Craniofacial Awareness Month.